Welcome back. If you or someone you know suffers from peripheral neuropathy that causes pain or numbness in your hands, legs, or feet, there are ways to help live your life pain-free. Joining me now is Dr. Dan Wallis, founder of Elevate Neuropathy in Fort Collins. All right, Dan, I'm so glad that you're here, but let's talk about this. What is peripheral neuropathy? I think a lot of people, they hear that word, it seems complex, and they don't really know what it is.
Absolutely. So what peripheral neuropathy is damage or degeneration to the nerves, typically characterized in the lower legs and feet, or oftentimes in the arms and hands. And it has many causes, such as diabetes, chemotherapy, environmental causes. There are all kinds of different ways, but it really results in a lack of mobility for many of our patients. And so that's typically how it's characterized.
So then how are the nerves treated?
Yeah, it's a good
or
question.
Or affected, I guess I should say. I guess they're affected and then you help treat those symptoms.
Correct. And so when there's any damage or degeneration to any of the nerves, what happens is that through that process, it can start to create signals to the brain that for many people turns into things like pain. Now, the problem is that neuropathy is progressive, and so it happens usually not overnight, and people start to feel some different symptoms. It might be numbness or tingling. It might be pain. It might be loss of balance. You know, if some people tell me, they're like, "Doc, I feel like I'm walking on marbles, or I'm walking on a bag of marshmallows." And over time, those things tend to get worse. And so it is a progressive condition that needs to be treated early.
Now, are there certain triggers that cause some of these symptoms?
It's a great question. There's over 100 different causes of neuropathy. Now, most people are used to things like diabetes, right? So if diabetes is not managed properly, blood sugar gets out of control, it can really damage the nerves. But also things like chemotherapy, infections, surgeries that went poorly, environmental factors, even alcoholism can be something that triggers neuropathy. Anything that takes the blood and creates a really poor environment for somebody's health can trigger symptoms of peripheral neuropathy.
Okay, so now that we've kind of got an overall view of what it is, can it actually be reversed?
The good news is that yes, it can be reversed, and that's why we get so excited about it. We find phenomenal results for the right candidates. Now, we like to try to get a hold of neuropathy before it reaches that 80 to 90% damage. It makes it really hard to make a difference. And what we want to avoid is people getting into things like walkers or wheelchairs, or at worst, amputation. And the key is to treat it early and often. And in our facilities, we use no drugs. We use no surgeries, there's no painful injections, just phenomenal therapeutics that frankly the patient can do in the comfort of their own home, which is a very big breakthrough, so that they don't have to come to the facility. It needs to be treated every day if possible.
Well, that was going to lead to my next question, because I'm assuming the pain that this causes also means that a lot of people might be on pain medications, right? Does that include things like opioids or something that they might not want to be on long term?
Yeah, it's a great question. So the classification of medications is different. It's things like gabapentinoids. People are used to terms like gabapentin or pregabalin. A common name for that is Lyrica. We see things like selective serotonin and norepinephrine reuptake inhibitors, which is just a long way to say things like Cymbalta. And all of these drugs, what they do is they treat things like seizures or fibromyalgia or depression, okay? And so what it does is it really just changes the brain's perception of the pain. It doesn't actually treat the condition. Now, is that important for somebody to even have some semblance of quality of life? I would agree, yes. But the problem is, if it's not being treated, it's going to keep getting worse, which means we're going to get more drugs and more prescription medications. And if misused or abused, it can lead to problems for many patients.
Let's also talk about the fact that you're trying to make this so affordable for folks to really help and better their lives, right? So you've got a great offer for our viewers.
Yeah, so we offer, first of all, a complete complimentary consultation, okay, where we can at least see if someone's a candidate for our programs. And if they are, we'll do a $49 initial evaluation. So that lets us know how severe is the condition, can we help, and if they're a candidate for treatment or not, for $49.
Wow, that's pretty nice.
Yeah,
that is
we want to make it
really
easy.
Nice to know. So if folks are watching right now and they're thinking, you know what, I'm dealing with this, how soon can they get in to see you?
We can see patients as early as the next couple weeks. If if needed. And these appointments are available virtually as well. So if people can't come see us for any reason, or they have some concerns with going out to a facility, we can do these appointments online if needed as well.
Well, that's pretty nice. And so many people, like you said, you have patients all over the place. So
That's right.
you make that available to them. So thanks so much for being with us.
Thanks so much for having me, Gina.
All right, if you or someone you know suffers from neuropathy, go ahead, call the number you see right there on your screen, 970-316-0785. Now, the first 25 callers, you're going to get $49 special. That includes a consultation, exam, and a report of the findings. They're located in Fort Collins, and Medicare and most health insurance plans are accepted. You can learn more by visiting elevateneuropathy.com. They paid for today's segment, and we'll be right back.